So glad to have you here. If you would drop into the chat who you are, where you're joining from. If you'd like to say your position, that's fine as well. And what has brought you joy this week? So I am Naomi Williams. I am the Patient Family Engagement Specialist with PFCC Partners. I am joining from Washington, D.C. today. And the thing that has brought me joy this week, I had a couple, but it's being with my people. So I had an opportunity to be with my colleagues earlier in the week, and now this weekend I get to be with my running family. So that is definitely bringing some joy. We are super excited about our topic today. So without any delay, let's jump in and get started. For those who are just joining the room, if you would drop into the chat who you are, where you're joining from, and what has brought you joy this week. We are recording the session, and you will be able to see this on our PFCC Partners YouTube channel. We'll have live transcript available as well. And we can do closed caption here as well. So this is what PFCC Partners is all about. We are here to collaborate with health systems, federal partners, research teams, and others to develop the infrastructure for high value and productive partnerships with patients and family caregivers to drive improved outcomes. This has been our mission and a part of our values since we've opened in 2010. We know that the healthcare system is complex. We recognize that. We recognize that it's layered complexity throughout multiple systems. Uh-oh. There we go. So one of the things that we do is being able to create and offer the space within our patients and family caregiver connections to drive those improvements. So PFCC Partners opens the space, and we have the PFA network that fills the space. It opens space for impactful partnerships through over 1,100 patient and family partners that are across the country that are open, willing, eager to collaborate and to help with the improvement of our healthcare system. So that's a little bit about PFCC Partners and our PFA network. So excited about our topic today, from partnership to practice, real-time patient experience. Let me move that. Real-time patient experience data through Patient Family Advisory Council, or PFAC engagement. So excited to have Deborah Ario and Carlos Benavides with us. I just wanted to share quickly, Deborah had sent over her bio, and she shared, I just love this, Deb, so just wanted to share with the group. I I have a responsibility to lead and the desire and willingness to be compassionate, uncomfortable, and responsive so that people feel seen and heard. And I think that embodies everybody that is on this call today. So with that, Deb.
Wonderful. Thank you, Naomi. And I want to, I'm watching the comments as Naomi, as you were speaking, I was watching the comments and I love family and I just love to hear the things that bring us joy. And I think, especially nowadays, we need to lean into those things that bring us joy and really center down as we move through today's landscape. So, my partner in crime today is Carlos Benavides, who is co-lead for our Patient Family Advisory Council here at Rancho Los Amigos. I also saw in here joining us today Dulce Garcia and Ray Pizarro, also from our Patient Family Advisory Council. Dulce and Carlos are co-leading the council right now, and Ray and Carlos used to co-lead. So if I've missed any of my other Patient Family Advisory Council members, my apologies. You can, you know, send me a text later on. But so what we wanted to kind of share with you today is a topic that has been really fun for us to develop, and it's called Real-Time Patient Experience Data through the Patient Family Advisory Council Engagement. And so I'll move you through the slides. I saw some of your earlier questions, but I think I will answer probably most of them as we go through this. So today's goal is for us to share how Rancho Los Amigos, the Patient Experience Council collaborated with the Patient Family Advisory Council to conduct real-time patient experience survey. And this presentation highlights the origins of the partnership, the comprehensive training provided to PFAC members, and the ongoing value of identifying and addressing emerging trends as they arise. And anyone who knows me will say that I don't do very well staying inside the box. So especially if there is a challenge or an issue, I'm like, let's think outside the box. What can we do? And then I like to go for it and build and build things that have are definitely sustainability. So next slide. So what is the Patient Experience Council? So we established, one of the physicians here, Dr. Michael Valeris, and I established the Patient Experience Council to really look at the patient experience from a pretty high level view. So we brought onto the council the person that is responsible for our HCAP data, the person that's responsible for our MPS data, which is our outpatient data. We brought on the chief of social work. We have our patient advocate in there, our chief of quality, our outpatient administrator. So we brought together, we have a patient, Sylvia Alleman, who sits on there also. So we brought together kind of who we felt were the stakeholder, the higher level stakeholders to talk about patient experience and be able to address stuff that we found sometimes was happening in silos. Now I know silos don't happen at any other places, especially hospitals, but we found that we do silo stuff. So in the course of the last couple of years, we've been looking at our MPS data, and I think and we do ours through Press Ganey, and I think what we were finding was that our response rate was so low that we were really like struggling with how do we change workflows or challenge workflows when it's from such a small population, or a small number within our outpatients. And so, we were talking about it as a patient experience council, and we said, well, what if we partner with PFAC? Like, wouldn't that be a great way? PFAC are patients and caregivers that are coming together to help us do what we do better. And they are our experts. And so we met with Carlos and Ray and said, "What do you guys think?" And they're like, "Well, yeah, I think this is good." And so, kind of the concept was that we would do these real time surveys, and we would collect data on a certain subset of questions. And the questions that we used for these real time surveys were based off of the MPS comments and scores that we were getting back. So things that the MPS was showing us that that we should be concerned about. We wanted to really kind of test it and to see, if that was true with a larger base of information and feedback. And so let me just jump right in and kind of walk you through that process. So next slide. So this is fine. So what we did was when we went to PFAC, we said, would you dedicate 1 hour per month to be on campus to conduct these pulse check surveys? And we were very clear, like, we want you guys to ask. There were I think we've done no more than 5 questions, but most of the time it's 4 questions. But it's meant to be a 5-minute interaction. You ask the questions, input the or you know record the data, and then ask them if there were anything else that they wanted to tell you, but really meant to like 5-minute interactions and then go on to the next patient to survey them, patient or caregiver to survey them. So we did a lot of talking around what happens if somebody's like, well, I'm having some struggles or I'm having some problems with X, Y, and Z. And so how do you kind of redefine what that interaction is meant to be? So let's go to the next slide. So here's the process for the survey. So PFAC members were instructed to come to Rancho wearing their volunteer badge. So they all are onboarded as volunteers, which I think gives them some legitimacy and some validity as they were going to go through and survey patients. Um, we went old school on this. We didn't want to get it too complicated with an iPad and technology and all of that kind of stuff. So we have clipboards up in our administrative office, which is probably the easiest place we felt for them to come and get the information. So they would come up into admin and they'd say, I'm here to do my PFAC surveys. And we had the survey, we have clipboards in English and in Spanish. So whatever was more comfortable for that PFAC member to collect the data in was fine with us. And so they would take their clipboard and it came with a pen, and on the back of it, and I've got some photos a little farther down in the slide deck that show you kind of what things look like. But on the back of the clipboard, we put kind of a reference guide. So if somebody asked, well, what's the number to social work? You didn't have to remember that, because I don't know about you guys, but I can't remember any phone numbers anymore. I think, cell phones and especially smartphones have just made me a little dumber, because I just can't retain that. So we created a cheat sheet for them. We wanted to make it as easy as possible. So they would conduct their surveys. Each survey would take no more than 5 minutes. As soon as they were done, and they could do as many as they could do in an hour. So they were done 2 up on a sheet. So you'd get 2 surveys per sheet, and then they'd return the clipboard to administration with all the surveys, both the completed and the blank ones. And then we would collect the data, we'd input the data as it went, but really look and analyze it on a quarterly basis. And then once that data was reviewed, we would share it with the Patient Experience Council, we would share it with PFAC, we shared it with the executive leadership team here at Rancho, as well as we've been doing quarterly shares with our management team. So the process, we try to make it as simple as possible, knowing that we didn't want it to be hard, because we want it to be successful. Next slide. So this is I think I did this in Word too, because I'm the word queen. I don't know how to do Canva. I'm a little old school, people. So here's my word skill. But this is how simple it was. So we asked them to put the date in, their name as a PFAC member. We wanted to know where they were going within our outpatient building to survey these patients. And so there's a 3rd floor hallway waiting room, the lab waiting area, 2nd floor dental clinic. We kind of looked for where our patients tend to sit or gather. Our 1st floor ENT clinic, our pharmacy area, and then we have a lobby and a cafe area. And so we just kind of wanted to get an understanding of where these surveys were happening. We wanted to know, when was the last time you were seen in clinic? So if they were there today, that tells us they were there for an appointment, sometimes like last 7 days. Like it could say, this survey was done in the OPB lobby near the Rancho Works Cafe, and the last time that they were seen in clinic was 7 days ago. So that tells me they probably came back for a therapy appointment or for pharmacy or some other need other than a clinic visit. And then again, here we're For this survey, here were our three questions. And so how well your nurse listen to you and or your family, how well your provider listens and considers your own needs in care, and overall how well did your medical team work together during the visit? And then we asked for any comments. And so next slide, I think I show kind of how we filled it out. Again, trying to keep it super easy. Um, Carlos, I used one of yours. I hope that's okay. Carlos, let me pause for a minute. And do you want to share kind of your experience as a PFAC member in doing these surveys with our patients?
Uh, yeah, good afternoon, everybody. My name is Carlos Benavides. Um, First, I want to tell you a little bit about the PFAC. It's a collaborative body. We're composed of patients, family members, caregivers, and healthcare staff and leaders. The importance, I think, of these surveys, and we've come to realize when we first started, we were even a little, hesitant on it. But you know what? These surveys have helped us reach out to the patients and make all the patients realize that we're actually there trying to make a change for them, that we are listening, that there are changes that are going to be made, and some of them have been made, thanks to the collaboration between everybody. That includes structural, that includes designs, programs, services, and we ask them what they need or what they feel is missing. And that's what we go back and we talk about and we collaborate on that. So as far as the surveys, they work out very well. Okay, and like I said, it does give the patient confidence to know that somebody is actually listening to them. Back to you, Deb.
That's awesome, Carlos. Thank you. And I'm looking in the chat and I see a question. Yeah, we did consider doing it electronically. But on our PFAC team, I think there are some of our members that would have struggled with it electronically. So again, we wanted to make it as easy as possible and remove as many barriers. We might, at some point we might evolve into an electronic uh, method, but for right now, this has seemed to work for us and has
And
been.
also, if I could add to that, right now the way things are out in the communities, people are more apt to talk to you if you're writing something down instead of putting something on a computer.
Yeah.
Especially they don't know where it's going to go, how it's going to be used, or anything else. If it's in black and white and we're not involving them, you know,
Yeah.
they're more apt to talk to you.
We also, in all transparency, sometimes have Wi-Fi issues. So I think that's another part of it. So we realized this was old school, but we've been doing it now for gosh, over a year and a half, and it's been pretty good. So next slide. Thank you, Carlos. So once we had designed the survey and we're ready to roll out the surveys and implement these surveys, we met with PFAC and we did a training session, and it wasn't very complicated or actually even very long, but we really wanted to make sure that we had enough time for them to ask whatever questions they may have. Because the only way that this was going to be successful is that if everybody felt comfortable with going and approaching people. And we had encouraged them, if you are not comfortable, if maybe you're an introvert and you're just not comfortable, go with somebody else. You can pair up. That didn't matter at all. We really tried to put as few rules as possible, again, so that our PFAC members felt comfortable. So we gave them a script. Hi, my name is Carlos Benavides, and I'm a member of Rancho's Patient Family Advisory Council. May I ask you a few questions regarding your recent visits to the outpatient clinics? And then you would ask them the questions and then ask them if they have any additional comments that they would like to make. And thank you so much for answering these questions for me. We're going to gather all of this feedback and use it to figure out how to continue to make your patient experience the best it can be. And then we also wanted to say, please remember after your visit today, if for those that were in a clinic visit, you'll receive a formal survey through either text or email. And we ask that you take a few minutes to complete that survey. Again, thank you and have a great day. So we wanted to make sure that they also knew like there's another survey coming, and we really need you to do that one also. And so that was the script. And so we kind of talked about, so when we did the training with the PFAC team, we talked about like, here's the process. So we showed the 6 squares that I showed you guys. And then we said, okay, here's the script. Let's go to the next slide, Naomi. Here was on the back of the clipboard, taped to the back is our contact information. I put myself as the primary contact. So if they had any issues, I said, if there's something you can't answer, you don't know what to do, just give them my number. I can handle it. Give them my number. So we added onto that, here's the survey process. Again, we wanted to re-emphasize, make this simple, keep it simple, and we added the script to the back. And we did these clipboards in both English and Spanish. So we've been doing this for a while now, and they're depending on what the questions are, we will change them or not. Sometimes we've gone like 6 months with a set of questions. Keith, you're asking if the PF surveys, they can do them either way. They can do them with a buddy, they can do them by themselves, whatever they're comfortable with. We've got a mom and son who sit on our PFAC team, and so they do it together. Mom's there as a caregiver representative, so they do theirs together, which is great. So what did this data look like, and what do we do with this data? So we went from our MPS response rates were maybe 40 responses, 50 responses. I mean, very low, very, very, very low, to almost 300. I think we're cresting over 300 in a 3-month period. That has been really good. And we've been able to show kind of what the data is saying. So you can see here, I just pulled up our data from January through March. And you see the breakdown of where the surveys were held. So most of them are held on our 3rd floor, which is where all of our clinics happen. Most of them were coming either to or from a clinic appointment. So you see at 62% was the day of survey. And so at this time we had pivoted in January our questions, because what we saw come out of MPS were some questions about patient privacy and feeling safe with patient information. And so we pivoted our questions. And so the first question, I'm comfortable confirming my personal information at the clinic front desk. So you can see the breakdown there. My nurse reviews my medical concerns within the privacy of an exam room. So, always versus most of the time. So most of the time led us to ask, of the clinic staff, then to have a conversation with them as, well, where else would you have a conversation about their medical concerns, and why is that happening there and whatnot? I believe data is meant to spur conversations, kind of a see, engage, act model. So you are seeing an issue, you engage, you talk about it with all the stakeholders that can be brought into that conversation, and then you start kind of the act process. I think sometimes in healthcare we move so fast that it is super easy to go from see to act and forget that engage part, or have a minimal engagement in really conversations that probably should have a larger base to them. So we asked the same question about provider reviewing their medical concerns within the privacy exam room. Next slide. And then we also wanted to collect some information about our portal, our health portal, because what we were seeing was there were some comments that came out of the MPS about the portal, but we also discovered that while our sign up rate is really high here at Rancho, in the 70 percentile, our utilization rate was super low. And so I'm like, well, I'm very practical. I'm like, well, it doesn't matter if we have this tool if nobody's going to use it. And why aren't they going to use it? Why? And so we ask questions like, do you feel safe using the LA Health Portal to manage your care? And what are your safety concerns with using the portal? And you can see, and this speaks a little bit to what Carlos was talking about, writing stuff down versus and there's no patient identifiers on the survey. So I don't think there's a sense of greater anonymity if it were on a tablet or whatnot, because we never write a patient's name down. But you can see there, our patient's concern was who can see my information, data breach, immigration status, wrong information. Some of them have experienced going into their portal and saying, wait, this isn't my information. And so of those 281 surveys responses, we had 155 comments. And so we took the data, but also looked at the comments. And so there were 25 comments about our appointments. It takes too long to get an appointment. There were 3 comments about caregivers. There was communication, three comments about communication. One of them being, I would like a doctor that speaks Spanish. Lack of customer service. We had 2 comments. We had 72 comments about the portal. Some thought it was great and easy to navigate, but a good majority of them were like, I just don't know how to use it. I don't know what to do with it. I can't get around it. I forgot my password and it's too hard, those kinds of issues. And so 3 issues around privacy, 3 issues around provider or comments, 3 comments regarding our resource center, 26 satisfied comments, which was great. 1 seating center comment, and then we had 10 comments around security. So what do we do with this data? So I take this data, and especially the comments, and I forward them to the individuals that are over those areas. So I forwarded the security comments to our individual who handles that our security department reports up to. And then the process is that they will take the comments, review the comments, and figure out, what workflows need to change or how do we address some of these issues. So there are a couple things. So the portal questions, our PEC, our Patient Experience Council, has decided to kind of get involved, I guess, and to bring ourselves to that table to say, okay, how can we help support patients feeling comfortable with using the portal? Because clearly, if they use the portal, they can do appointments on the portal, they can do pharmacy prescription renewals, they can look at their labs. So there are things that they can do that would maybe not, they wouldn't feel the need to call the hospital, to call the department to say, hey, when is my appointment or whatnot. So, I think there is that win-win, but recognizing that the people working on the portal and signing people up, that we needed more of a focus on how to build a team to address these concerns. So we brought in IT to say, what can we do from an IT standpoint? We have a IT tech bar here in one of our buildings. And so could we direct patients to the IT tech bar if they're having password issues, and that the techs could help them just reset their passwords and walk them through that process? Could we use our No Barriers peer mentor group to develop a class, an English speaking class and a Spanish speaking class that occurs once a week about how to use the portal and whatnot. So we are in the process of moving through some of the feedback from this survey. This survey we've been surveying off these questions since it was January through the end of July. And then in July, again, to show kind of how we were able to pivot with this 5-minute real-time survey, we had a clinic realignment. And so instead of having our clinics divided over clinic 1, 2, and 3, we created a primary clinics and then specialty clinic. And so what we wanted to do is gather information specifically from patients about this realignment, and did it make sense, and did it help with the workflow? Are they able, by doing that, we were able to open up more appointments, which hopefully meant that they didn't have to wait so long to get an appointment. And so we're just now looking at the data. Actually, we've been looking at that data on a monthly basis, just because we want to be able to pivot the teams if we need to, or deal with stuff in real time. But this has been, I don't know, Carlos, I'm going to speak from the Patient Experience Council in that this has been really fun to get such good information and such good feedback, and to be able to figure out how do we respond and really make some changes that are going to benefit the patient experience here at Rancho. And we could not have done it without PFAC. I mean, PFAC was really the best partner that we had to do this. And so we are grateful that they were willing to partner with us on this.
Yeah. No, we enjoy the collaboration, Deb, and everybody out there. And the one thing that I wanted to say, and it doesn't show on the sample that she put up there, the reason that they were talking so much about security is because here at Rancho, they really emphasize patient experience, and their security at both sides are the first people that the patients see. So on the very first survey that we started, we wanted to make sure that when a patient came in, they were comfortable from when they walked in the door to their appointment, to their provider, and then left. So that's another reason it was on there, and that wasn't emphasized. But you know what? Collaborating, it's come a long way, and that's all I can say is, you know what? It's all through patient experience, and that's why the security was so important. So thank you very much.
Thanks, Carlos. And yeah, I think that I would love to kind of turn it back to this group and have some questions. There have been some great questions and thoughts in the chat. I wish we had the bodies to have tech specialists in waiting rooms. Like everybody else, human resources are always we're always wanting more. And so I think that's why we couldn't ask the staff to do one more thing. And we didn't want the patients to feel I don't know, we didn't want them to have any sense that this would impact their care at all. And so, again, another reason why kind of that peer-to-peer questioning has seemed to work and been a good process. And I'm happy to share. I believe you create things to share. Nobody should have, I like to work smarter, not harder. And so, if there's anyone that is interested in getting our file, I can send you the template, my Word template. Again, not very sophisticated, but it works. But I can send you what we have, and I'm happy to share. And then you can adapt it, to your organization.
Thank you for that, Deb. Keith, I see your hand. Real quick, Keith, before you ask your question, Deb, can you share where you go next? So I know when we had spoken earlier, how you all had the engagement of the PFAC, and we're looking at adding a PFAC member to the Patient Experience Council.
Yeah, we absolutely. I think anytime we can add a PFAC member anywhere is a good thing. So Um, we do have one patient, we do have a patient sitting on the PEC, but I think as some of the PFAC leadership changes, I think that's a great opportunity and a place for us to keep that the leadership engaged, but at different levels. So yeah, I think your PFACs, our patient family advisory councils, or whatever you guys call it at your organizations, are just such invaluable sources of information and connection. And that they have a different rapport with patients than we do. And especially at Rancho, because most of our patients are living with disability. And so it's one thing for me to say something to a patient, whether it's encouraging or wanting to help them find resources, but it's another thing when that's addressed from the peer standpoint. And so I think yeah, we probably don't use PFAC enough. And I'm constantly thinking, okay, how else can we use them? How else can we use them? But I am very grateful that we have this resource here. So
Thank you. Keith, and then Dulce, I see your hand. We're going to go to Keith first, and then I'll come to you, Dulce.
Yeah, thank you. Thank you very much for sharing this work. I think I'm super excited. We actually have a patient experience council at our hospital, and so I'd really like to take this idea back to them. And my job is to advocate for that PFA, that patient family advisor, to be in that council. The other biggest thing, I think it's great. My first question when you started presenting was, do you go into inpatient areas? And so it's great to see the outpatient, which I think that's a great way for us to get those kind of patient experience metrics. And so really kind of thinking of like, where can we take this in the inpatient world? And so that was my question about budding too, but it makes sense if it's just like in the waiting areas. But yeah, I really appreciate your time and thank you for sharing. And it excites me to see this work going on.
awesome. Thank you, Keith. It's funny. That was part of the conversation when we were like designing this survey process. And again, like, let's do something smaller and be really successful before we go, now we're going to take it on the road. And so, also, our inpatient scores are different. They are having higher returns. Rancho has about 3,000 inpatient visits a year, but almost 90,000 outpatient visits a year. So that too is one of the reasons, because we were like, that 90,000 outpatient visits is huge. And if they're not responding to the Preskini survey, how else do we get data? Because we want to keep making the patient experience better. So, we haven't, in total transparency, we haven't circled back to taking it to the inpatient. I think we're feeling like this is a good place for us. But not to say that that can't happen at some point, especially if we felt like there was a need, as if there were issues coming out of the inpatient area that we could support.
Thank you for that. Dulce?
Hi, Dulce.
Hi, everybody. Hi, Deborah. I just had an add-on as to the experience with the surveys. I know I had a couple before that I ran into doing the survey that had no idea we had a PFAC. So once they did, they were like, "Oh, great! They have patients that are actually patients here, and they are listening. They are willing to." So when they see you on campus, they don't wait for you to have a survey. Like, "Hey, I'm having this issue. Maybe the bars in the restroom or something like that," so that you're more approachable. And also for our new members, it was a great way to introduce them as well to our community, so they knew that we do have new faces. And wherever you go, you see that tag, you see our employee badge, feel free to stop us and ask. So I think it was also great to introduce PFAC to a lot of the community that didn't know.
That's an awesome share, Dulce. Thank you for that. I think yeah, and it's a great way to, like, you come across that in while you're doing your surveys, and you come across a patient or a caregiver that really just has some enthusiasm around feedback and the experience and whatnot. hey, it's a great place to look for new PFAC members, a great way to find new PFAC members. I know we all struggle with that too. So
That's a great answer to that was several questions that came in with registration in the sense of how do you recruit and how do you get new members. Thank you for that. I see some questions in the chat. One is, has this resulted in an increase in Press Ganey survey returns?
it has. It's hard to measure the data from Press Ganey versus our data, but we have seen an increase in the number of returns that are happening through the MPS survey. So I think that one statement of like, don't forget, please answer the survey that you're going to get is super helpful. And quite honestly, we could probably do a better job at reminding patients when they are done with their clinic visits, like, don't forget, you're going to get this. I don't have any data on how consistent we are in that area, but I think that is always an area for improvement. It's hard. There's a lot of things to talk about with a patient in 20 minutes, you know. And I don't blame the staff. Like they're moving as fast as they can and wanting to connect with every patient as they come in and out. So I mean, the good news is we're never going to run out of questions to ask patients. And we're never going to run out of patients to ask questions to. So I guess that's a win-win.
An add-on to that question, one that came in was about survey fatigue. And so I don't know if you and or Dulce or Carlos might be able to speak to that. The question was about how do you get over survey fatigue?
Do you mean us doing the surveys or people answering the surveys?
Sorry, people answering the surveys is what I believe the question meant.
Luckily, the few people that I have taken the survey when I'm asking have told me I've already been surveyed. And I just go, are you just want to make sure it was these questions? Because we do change our questions. So I run through the questions and sometimes I find, oh no, I didn't get that survey. I had another survey. Or else I already had that survey or I don't want to do the survey. I always let them know, you're free to say no. Don't feel obligated. But this, we're not asking for your patient information, yada, yada. For the most part, like I said, they're pretty vocal. They'll tell you, I don't want to take it, or I've already taken it. And like I said, just go over the questions and then they'll tell you, oh, I'm willing to take it. Because they do see the changes already in clinic.
Right. And also on that note, a lot of the patients will come reaching out to us again, even if they've taken the survey 2 days before, because every day there's a different scenario. Okay. And that's something the patient feels something that could be changed. Maybe he didn't realize it the first time we were doing the surveys. But it's not like a fatigue out here. People are looking out. They're actually looking for something to say to make a change here at Rancho.
Thank you for that. Ray, I see your hand came up.
Yes. Another thing that PFAC worked on with the fatigue factor is keeping the questions small to three questions. They were condensed so people don't sit there too long. I know they have things to do and their attention span could be somewhere else. So when we present the questions, I start off with we have three simple questions that are anonymous. If you don't mind us asking these questions, it'll take a minute to go through them with you. It'll help us tremendously, and that usually does the trick. Of course, when I present myself, I let them know who I am, and this is how we work together with the hospital. And it's a pretty seamless experience. So I think the amount of questions also helps with fatigue.
Thank you for that. Another question that has come in is, does your new portal communicate with other portals that other physicians use in order for everyone to be on the same page?
My answer is no. This is the first patient portal that we've had. So it does, we're working to integrate it even more. There are things that we would like as we're talking about collecting data around um, social determinants of health, could we add into the portal where they can answer the questions so that we are getting better data on the social determinants of health or better SOGI data, like any of that. So yeah, there are also some other things that we've discovered in asking these questions about our portal is, one of the questions is, well, I emailed my doctor through the portal and he never got back to me, or they never got back to me. And come to find out that the amount of messages that the physicians get are so high that it's hard for them to get through everything. But what we were finding is there was stuff ending up in that bucket of messaging that needed to be someplace else. And so we're kind of discovering some flaws along the way and then trying to address them as we've been working on this. So I'm sure you guys all know, nothing's as simple as, well, all we need to do is fix that, because you fix that and then four other things are like, oh, well, how do we do that? Could we fix that? So it never moves as fast as I'd like it to, but at least we keep moving forward. Um, Thank you for that question.
Mhm.
Can I just add something?
Sure.
I'm not sure if everybody knows that luckily with the portal, it gets to all of our county facilities. So, for example, I know Rancho doesn't have an endocrinology, so I go to Martin Luther King. Martin Luther King is able to look at this, and I love it because my endocrinologist keeps an eye on, okay, you saw your primary, what was it about? And maybe this is what's affecting your sugar levels. So that's great, but like Deb said, it's hard to get all the quirks out, the little kinks out as well. But for the most part, yeah, if you guys are able to push it to where you tell your patients this is great because you can check your lab work, because that cuts down also the phone calls that you're getting for minimal things this way. I would say if you guys are able to, like here, they worked with the peer mentors, so they have a resource center. So if they need help setting up their portal or understanding it, we send them there, and there's people there Monday through Friday until 2 p.m. And they're able to sit there and tell them this is what it is. If you need more help, come back and do it.
And one thing, if I could add also, and it's not just for the portals, for the surveys also, is you know what? When somebody comes in for a visit, they sit there and they have all these things going through their mind. When one of our PFAC members or somebody that's going up there and just introduces themselves and just gives them a conversation, it eases their mind and they have somebody that's actually there that cares about them. So they're not so preoccupied about what am I going to say? What am I going to do this? But you know what? They feel that, hey, you know what? Like, hi, Naomi, how you doing today? Can I ask you a couple of questions? It's that simple. Somebody actually cares, and I think that's what's so important about this. And I think that's what this collaboration is all about, patient-centered care.
That's a great way to end our time together, Carlos. Wow, we didn't even script that. That was awesome.
Thank you all so much. Don't leave us just yet. I have one other um, slide to get to. Thank you so much, Deborah, Dulce, Carlos, Ray, for the work that you're doing, for joining us from Ranchos Los Amigos Rehabilitation Center. Did not mention the whole name earlier. So thank you. And Lindsay, I want to pass it over to you.
Yeah, thanks so much. Yeah, thank you, Deb and Carlos, Ray and Dolce. This was just such a great example of, real patient engagement. And Carlos, I want to clip what you just said and share it with everybody. So, so well said. So thank you for that. Just in to wrap us up, I do want to invite all of you to our next Community of Practice workshop on Friday, December 5th. Um, we will be sharing the Lived Experience Summit outcomes. So last week we were in Portland at the Putting Care at the Center conference with Camden Coalition, and we hosted a summit in partnership with Melinda Karp at the Center for Advancing Consumer Partnerships and another partner, Gabrielle Alt-Ritchie, and our team. The summit was 3 hours long and solely focused on aligning dollars through dialogue. So we collaborated with anyone who wanted to come into the room, and surprisingly, everyone wanted to come into the room. We had 50 people in the room, and we had to unfortunately turn away 20 extra people because we were at capacity. The beauty of the summit is that we kind of flipped the script, and so you can see at this packed room at each of the tables. The goal was to have more people with lived experience than we did have healthcare partners or healthcare professionals. Because, for the most part, as a patient family partner, you're brought into a room or to a project, and you're maybe the first or one and only patient family partner, or maybe there's another patient family partner there. So this kind of puts it on our healthcare partners, and really was their opportunity to learn from patients and family caregivers and community members about what they value in healthcare and what health plans should be paying for. So we are working rapidly to collect all of the outcomes. We did a bunch of activities and probably went through about 2,000 sticky notes. So we're going through that, but at the next workshop is where we will present all of our outcomes, and yeah, just welcome you to join us and learn, and then be a part of, okay, now that we know this, what can we do with the information? So look out for that. We'll share the link to register. And yeah, that was the plug that I wanted to do. So again, thank you, Deb and the Rancho Los Amigos Patient Family Advisory Council for your presentation today. We recorded this session, so that will be up on YouTube. We'll include the link to the next workshop in the follow-up, as well as the recording. And yeah, stay up to date with us on LinkedIn. We're posting a bunch of other stuff that we've been learning or that we learned in Portland. So thank you so much. And thanks, Naomi, for facilitating a great session. I hope you all have a good Friday afternoon and a lovely weekend.
Thanks, all.
Thank you, everyone.
Toodaloo.